Good evening. My name is India Brown, and today we'll be going over the ORIF Humeral Fracture Precautions. Following the completion of this lecture, you will be able to demonstrate knowledge of an ORIF precautions by completing a case study. You will be able to briefly define ORIF. You will be able to differentiate between a fracture and a bone break. You will identify the stages of healing post-op. You will be able to classify the types of humeral fractures, and lastly, you will state the common assessments that are used with an ORIF. So you can take a second to identify the bony landmarks listed here on the slide for you. You will hear several terms throughout this lecture. The more common ones that you'll hear are referring to the proximal portion of the humerus, the medial portion of the humerus, and the distal portion, and those are respective to their locations on the humerus. You'll also hear the head, and you'll hear the body, which is commonly referred to as the shaft. So, being in the health field, we may hear people refer to a fracture and a break being used differently. They may think because the bone isn't completely broken in half that it's not a fracture. They may only think that a fracture can be like an impingement on the bone. However, with further research, it is determined that the term fraction and fracture and break are used interchangeably, and it's just described as a structural break in the bone and its epiphyseal plate or cartilaginous surface integrity impairing that bone. So, how do we determine if a person has experienced a fracture? Well, there are several ways that we can identify it. First, we can take signs and symptoms, and that is usually associated with bruising. That's like a discoloration of the skin. There's usually edema or swelling of it, a stiffness. The person reports that they can't move it or if they can't feel it. And then sometimes, if the bone breaks all the way through, then it's associated with blood. However, if these signs aren't prominent enough, we can take it a step further and have the person get an x-ray, which will determine if there's been a fracture in the bone. How do we fix fractures? Well, there are several ways. In ORIF, which we'll be discussing throughout this lecture, there's an arthroplasty, which is more common also, and that's just when a plastic or metal pieces is placed into the shoulder. And we have a closed reduction internal fixation. In this case, it's the same procedure as an ORIF, however, it is closed. We have immobilization, which is also commonly seen as it's just stabilizing their shoulder and allowing it to heal without any type of surgical procedures. There's also percutaneous pinning, and then this is the use of wiring and sticking pins through the arm, and this is minimally invasive. And then lastly, we have intramedullary, and that is a process of using nails to hold the humerus back in place. So there are several different types of fracture, which some earlier were like stress, transverse, oblique. However, there are three different types of humeral fractures. So the first one is the proximal, and by the name, you can usually tell where it is. So for the proximal one, that's going to be near the humeral head, the greater and the lesser tuberosities, in the proximal shaft area near that glenohumeral joint. The humeral shaft, so that's going to be like the mid part of your humerus. And like I said, sometimes that can be determined as transverse, oblique, or comminuted. And then lastly, we have the distal humeral, which I'm sure you can guess is going to be the distal portion of your humerus, which could include that supracondylar region and the lateral and medial aspects of the condyle. So here we have our fast fracture facts. First one is going to be that proximal humeral fractures account for about 4 to 5% of all adult fractures, with 50% of those being humeral fractures in general. Humeral fractures are most common in the geriatric population, especially women. Distal humeral fractures account for about 2% of all fractures, and they expect that to triple by 2030. And the most common complications of these procedures can include hardware failure, non-union, malunion, elbow stiffness, and ulnar neuropathy. And you can assume that some of these happen by maybe there's fear of moving it once the surgery is completed, causing those contractures. Maybe they lose feeling after not moving it for a while. Any of those things could contribute to complications of an ORIF. And lastly, studies have also found that epilepsy, dementia, and depression have all been identified as possible causes of proximal humeral fracture occurrences. Knowledge check number one. What type of fracture is displayed in this photo? Please refer to the later slides for the answers. So how long does it take for an ORIF to heal? Well, for starters, that can depend on the severity of the fracture and the person's compliance with their rehabilitation protocol. But according to research, in general, it can take approximately from 3 to 4 months. But within that 3 to 4 months, as I stated earlier, depending on the severity and their compliance with protocol, they do have a risk of non union, and that's about a 1 through 12% per chance. So, what is OT's relationship in the ORIF process? Well, according to research, OTs can assist with upper extremity rehabilitation. We can assist with ADLs, compensatory techniques, physical and functional mobility, pain management, the restoration of strength and motion. However, when trying to identify protocol, research did suggest that there should be a standard protocol across the board for all practitioners to use, and they also stated that maybe an upper extremity rehabilitation protocol could also be used to help, treat these upper extremity issues, not only limited to an ORIF. So here I have pictured the different types of occupational therapy interventions that one may experience after undergoing an ORIF. So you can see a lot of upper body strengthening, but then you can also see the hand one in the middle, and that's because it's not only the humerus that's affected, it usually goes down the whole entire extremity. So not only are they decreasing strength at the shoulder, but there also is a decrease in strength at both the elbow and the hand. So there's upper body strengthening activities that they do in therapy. And then you can see the sling, which can be used. It can be used as an adaptive equipment. This is for when they undergo like the immobilization part of recovery, and this is so that the humerus isn't moved out of place, and it's just there to hold it. So continuing with OT, here are some of the devices and tools that we can use in therapy. So in the first picture, you can see the guy's arms outstretched, and he's being measured with a goniometer. And then you have weights, and you can measure with weights. You can use it as a form of progression. Maybe the person who experienced an ORIF, they used to be able to lift it at a higher weight, but now they're back lower due to having a surgery. And then as they gain greater strength, you should notice an increase in the weight that they're able to pick up and lift. So there's ice in the middle, which is a modality. There are several other modalities, but in the case of an ORIF, it's most common to use cold packs or icing due to the fact that there's edema associated with ORIFs. And then in the top right corner, so this is a very old version of a dynamometer. It's very different from what I've seen and experienced in both fieldwork and in class. But yeah, that is just a way to use and measure someone's grip strength. And then, as I said earlier before, that it's not only the shoulder that's being affected, it usually goes down the entire extremity. So with an ORIF, you may see a decrease in how many pounds this person can squeeze due to the fact of them having the surgery. So you can use it as a means of progression by determining a pre-test and a post-test to see if the person is making progress as you're providing therapy. And then another item on the bottom right hand corner is a resistance band. And resistance bands can also be used as a means of measurement as they come in several different weights or sizes. You may hear someone refer to them as firm or lightweight or heavy, and it's just measuring the amount of resistance that it's applying to the person. Again, you can also use it as a means of progression because maybe they're starting out with lightweight when they're first coming to rehab, and by the time that they leave, they may advance to heavyweight resistance. So here we have the risk and the benefits of undergoing an ORIF. So as one may know that anytime you undergo a surgical procedure, there are risks associated with it. And in this case of an ORIF, a person has risk of experiencing inflection, bleeding, nerve damage, soft tissue damage, obviously decreased range of motion, a delayed healing of the humerus, and even complications of anesthesia could be a risk. However, there are great benefits to one receiving an ORIF. They can have an increased quality of life, decreased pain, restoration of their mobility and strength, overall improved healing. And it's also noted that you undergo it's faster recovery time opposed as if you just take the immobilization route. And then a major one is that you'll have bone realignment. So hopefully the bone realignment assists with all of the above stated benefits. How does one prepare for surgery? Just an FYI, this may vary from hospital to hospital. Different physicians may have different protocols, and it also can depend on the patient themselves, whether they have previous medical history that could affect the surgery in some way. They may have different tasks for one to do before surgery. But the general ways to prepare for surgery could include no smoking, no inflammatory medications such as ibuprofen, Tylenol, Advil. You should definitely disclose your allergies or current medications to your physician. And then also, you want to try not to use the arm that's going to be undergoing the surgery. So, what do you expect during surgery? So, you can expect to be placed under anesthesia. You can also expect to have the images of the fracture on the x ray so that the physicians can see what they're operating on, where, and how to go about that. And again, depending on the physician, but according to research, you're usually positioned in a beach chair position at a 60-degree angle. You can also expect to have a surgical incision made depending on the type of procedure you undergo for your humeral fracture. But the ORIF specifically is going to be done in 4 parts that we'll discuss on a later slide. So, what is an ORIF? Well, the correct term is an open reduction internal fixation. And what happens during this process is the bones are held together by special screws or plates to the outside of the bone to realign it, which is the reduction portion of it. And then it holds the bone fragments into their normal place. And then sometimes, depending on the severity of the fracture, they can insert a rod through the center of the bone for additional support. So, when performing this procedure surgically, it may be done in a 4-step process. The first step, they'll have this axillary nerve identification. And then the second step is they'll identify the location of the bicep tendons, and then they'll make a suture to access the humeral head. And then third is the actual process of the reduction. And sometimes they use K-wire, pins, needles, or any of the above mentioned. And then lastly, that's when the fixation occurs, and then they complete it by closing the surgical incision that was made. Now let's check number 2. What interventions can occupational therapy provide to one who has undergone an ORIF? When creating the protocol for this ORIF precautions for 0 to 8 weeks, a common theme that was found between the studies was that the same treatment guidelines follows for a non-operative treatment can be the same for the surgical treatment of an ORIF. And that is because of the stabilization of the fracture that was provided during the ORIF. So another common theme with the research on an ORIF with the humeral precautions, it seems that most researchers, doctors, therapists, they all get the basis of their foundation when creating their protocol from this 3-phase protocol that was described by Hughes and Neer. And they created this in 1975. And it just gives a rundown of the progression and the recovery stages from an ORIF from 4 to 6 weeks to 8 to 12 weeks. And as you can see, it starts off easy, but there's always some type of movement, whether it's just range of motion or any type of like pendulum swings. And then, as you can see, it progresses through the weeks, and then with it being increasing weight and changing up the type of exercises. Now, what you may consider whenever you look at protocols is that the weight bearing restrictions may be advised because it varies from person to person, and their primary care physician may have different weight bearing restrictions for them as they go through their recovery stages. So, as stated before, that an ORIF can follow the same guidelines as a non-operative protocol. So, what we have listed here is a published protocol, and it starts off in day one, and it goes up to about 6 to 8 weeks. And as you can see, once you read through it, you'll see that it starts off very easy and it's just controlled pain management, edema reduction techniques, and slight range of motion. But as you can see through the days and the weeks, the intensity increases, the exercises increase, and they starting to wean off of the sling, and it also goes into ADLs as well, so that by the time they reach weeks 6 and 8, they should be fully recovered. They should have improved strength. They should be able to contribute to the ADL process, and it should be little to no pain here. So if you Google an ORIF protocol on the internet, what you'll find is that most hospitals or rehabilitative centers, they have their own protocols that they have for the patients to download and follow at home. So this is one of the things that research talked about when OTs were giving treatment to these patients who experience these types of fractures, is that there's no set protocol. They just kind of work hand in hand with the patient's physician. And during the bone healing process, as I stated, that's primary care physician is key in this situation because they may have weight bearing precautions. And again, it just could depend on the severity of the fracture and the patient themselves. Knowledge check. Name a modality that can be used when treating an ORIF. So, how do we assess an ORIF humeral fracture in OT? Well, we can use pain for sure, and that's just your numeric rating scale. How do you feel out of 1 to 10? We can also do range of motion to see what their range of motion is prior to surgery and after surgery, and then after they have followed a rehab protocol. We can use the DASH, which is the disabilities of arm, shoulder, and hand. And then for the psychosocial component, we can use the DAS, which is the depression, anxiety, and stress scale. So the DASH is a 30-item self-report questionnaire, and there's two versions. There's the regular version, and then there's the quick DASH, which is a shortened version. So with this test, it assesses the person's ability and it's their personal opinion of how they would rate themselves in that situation. So for an example, it may ask, how much difficulty do you have opening a jar, or how much difficulty do you have washing your hair? And they may rate it mild difficulty to a lot of difficulty. It just depends on their personal preference, and they can use it as a pre and a post test if the therapist may do so. A more common assessment would be range of motion. And you have the three types. You have the active range of motion when a patient is independently able to move their limbs or body part. You have passive range of motion, and that's when the person needs assistance from another person to lift that arm or limb. And then lastly, we have active assisted range of motion when the patient can contribute to moving, but they still need an additional assistance from an outside force to help move them. And this could be due to anything from weakness or just pain in general. So this is the depression, anxiety, and stress scale. From an OT's perspective, the reason why we want to assess this is because maybe the severity of this person's fracture has hindered them from participating in their ADLs, and now that affects them socially and mentally. So the way that we assess this is it's a three-part self-reported scale, and it asks questions about how they feel, but it's a negative perspective on it. And there's 42 questions, but they also have a short version, but this can be downloaded on the internet for public use. Knowledge check. Assuming this patient independently reached approximately 110 degrees of shoulder flexion, what motion is being performed for her to achieve full shoulder flexion? Practice case study. Ms. Humeral is a 68-year-old woman who loves to garden. However, during her usual routine of gardening, she tripped over a water hose and sustained a proximal humeral fracture to her right arm. She is currently in week 4 of recovery, and she continues to deal with slight edema after performing her daily exercises. 1. Identify at least 3 precautions she should follow. 2. Provide exercises for her to complete on her own. And lastly, what modality would you advise her to use for her edema? Practice case study.
Answers.
Ms. Humeral is a 68-year-old woman who loves to garden.
If you look closely at the
However,
picture, you
during
can
her
see
usual
that in the
routine of
darkened
gardening,
portion
she tripped
at the
over a
top
water
of the
hose and
humeral head,
sustained a
that it
proximal
was
humeral
fractured
fracture
on
to
the
her right
proximal
arm.
portion.
She is
Number two,
currently in week
you could have
4 of
said anything
recovery.
from range of motion,
Identify
upper
and
body
list 3
strengthening, grip
precautions and
strengthening,
or
and more.
exercises
And
for her to
lastly,
complete
the
on her
action was
own.
passive range of motion. Here I have created an ORIF protocol for you to download at your leisure. And that concludes the end of this lecture. Thank you for joining and listening. If you have any additional questions about any of the material, please feel free to email me at any time. Thank you.